When people think about heart attacks, it's often very dramatic. The way it's sort of shown in films is an individual have sudden onset, severe chest pain, and then collapse to the floor. And it doesn't really happen that way at all. That is one extreme of a heart attack, but heart attacks can present in many different ways. And that extreme is actually not the most common. Heart attacks don't happen suddenly. It's usually a gradual process that creeps up on you. I'm Dr. Joban Sehmi. I'm a consultant cardiologist specialising in advanced cardiac imaging. Every week I see many patients who are worried about their heart, chest pain, breathlessness, their blood pressure, their cholesterol. In this video, I'm going to show you how to protect your heart health in 2026. If you think heart attacks happen only after the age of 60, then you're already in danger. It's really important that you stay vigilant to subtle signs that there may be an issue with the heart. Okay, it's very unusual for the first time a significant heart event happens is when you collapse with severe chest pain. If you look very carefully and in the history, you'll often see some early clues or some early signs. So these can be very subtle, these can be really vague, but the kind of symptoms that may indicate that there is an issue with the heart may potentially lead to a heart attack include things like chest tightness. So heaviness, tightness in the chest consistently comes on when you exercise, may indicate there's a significant heart issue. If not addressed, as an extreme, could change into a heart attack. It's very unusual for someone below the age of 40 to have significant heart disease, but it definitely does happen. So we see this in people who smoke very heavily. There can be an underlying genetic reason, so there may be something you've inherited from a family member that predisposes you to heart disease at a young age. And this can be an issue such as diabetes, or if you inherit an inability to process cholesterol in your body. These can predispose to heart disease young. So just because you're young doesn't mean you're immune from having heart disease. So the critical thing is to be informed about the type of symptoms. And if you do develop symptoms that are causing concern or suggest that there might be a heart issue, you're not wasting anyone's time by getting checked out. Heart disease does happen in younger individuals, and do not ignore these important symptoms. When it comes to risk of heart disease or risk of heart attacks, it's really important to understand an individual's overall health and understand their risk factors that may predispose them to heart disease, potentially heart disease at a younger age. So when I consider risk factors, we know that diabetics, whether you're type 1 or type 2 diabetic, this increases the risk of heart disease several-fold. If you have high blood pressure, this also increases your risk of heart disease because your heart is working very hard, and having high blood pressure accelerates the process of narrowings in the blood vessels of the heart. Cholesterol is an incredibly important risk factor for heart disease, particularly bad cholesterol, which is LDL cholesterol. So cholesterol is a molecule that's circulated in the body, and we need cholesterol for our body to work normally. But if you have an excess of cholesterol, this can be deposited inside the blood vessels of our heart. And over time, if the deposits increase in size, these can block arteries and cause symptoms that may need to be addressed. We know that heart disease is more common men than women, but female gender alone does not protect you from heart attacks. You're not immune from having heart disease. So it's really important that both genders understand their risk factors, address their risk factors to mitigate their future risk of heart disease. There are several lifestyle factors that can be put in place or implemented that can have a strong and beneficial effect on your risk of heart disease. These include diet, exercise, maintaining good sleep hygiene, avoiding smoking, addressing stress. And I'm going to talk about each of these in turn. Diet is really important. We know that the best type of diet that reduces your risk of heart disease the most is a Mediterranean style diet, which is rich in vegetables, white meat, fish. We know that people who live in the south of France, in Italy, they routinely live to their 80s and 90s, and heart disease is relatively uncommon in this population. And this is correlated with the lifestyle choices they make, essentially the food that they eat. It is really important to avoid ultra-processed food. It's really important to mitigate how much red meat you eat. And as I said, if you can adopt a Mediterranean-style diet, which is rich in olive oil, fruits and vegetables, then we know that this has a beneficial effect on your heart health. Another important lifestyle implementation is intermittent fasting. So what this means is restricting your feeding window to 8 hours. So have breakfast a little bit later or miss breakfast altogether and have dinner a little bit early. Your feeding window should be 8 hours. Exercise is critically important. Now, this doesn't mean that you need a gym membership. It doesn't mean you need to train for a marathon. The bare minimum is 30 minutes of moderate intensity exercise every day. And this can just be a brisk walk, not a stroll, a brisk walk where by the end you're a little bit sweaty. That is completely sufficient. Doing that 5 days a week is you'll hit your targets. We know that smoking accelerates the buildup of deposits in the blood vessels of your heart. And as these deposits increase in size, these can cause blockages or worse still, cause heart attacks. It's never too late to stop smoking. Even if you've been a smoker for 40, 50 years, stopping now will have a beneficial effect on reducing your risk of heart disease. Getting your heart health assessed by a specialist in heart disease is really important. So my role is to try and understand your cardiac risk factors and identify areas that need work, and obviously to congratulate you on things that are being done well. When someone comes and sees me for a heart assessment to try and understand their risk of future heart disease, I do very simple assessments to begin with, things like a blood pressure measurement, simple blood tests to understand your cholesterol levels, and I also screen for diabetes in all patients. I carry out an ECG, which is a basic recording of the heart's electrical activity. This can often give an indication of early problems should they arise. Anytime a patient experiences new symptoms that cause anxiety or worry, always seek medical attention. You're not wasting anyone's time. But in terms of significant symptoms, any chest pain that is new, that is actually not very painful, but more of a pressure or a tightness in the chest, particularly if it travels to the jaw or the left arm, may indicate a significant problem, and absolutely please get yourself checked. If it's associated with breathlessness with exertion, any chest pain that's brought on with exertion, relieved by rest, again may indicate a cardiac problem. In summary, it's really important that you are aware of your risk factors for heart disease, what lifestyle factors you can implement to mitigate this risk. A simple heart plan for 2026 should include walk, move daily, at least 30 minutes every day, brisk walking, eat, prioritize vegetables, lean meat, and avoid ultra-processed food. Intermittent fasting is also very helpful. Get yourself checked out, get your blood pressure assessed, get your blood work assessed, identify problems early, nip them in the bud before they cause a detrimental effect. Stop smoking, stop ignoring early symptoms, stop smoking, stop delaying checkups.